It's my pleasure today to introduce to you Mary Barron. She is a clinical dietitian at the Hospital for Sick Children, serving the Division of Hematology on Oncology and Bone Marrow Transplant Program. For many years, she has worked closely with children with cancer and their families to address feeding and nutritional issues during active treatment and beyond. Ms. Barron has written a book, or has written and presented widely on this topic.
Hello, everybody. Many faces I know, some I don't know. Can I share your story that you told me when we were here? I think it's quite fantastic that Carol told me that her son is doing very well many years after treatment, and today of all days was the day he was diagnosed many, many years ago. So we've gone full circle today. Thank you, Carol. So when Laura asked me to speak today, she gave me a wide range of issues to talk about in a very small span of time. So I'm going to talk a little bit about nutrition during treatment, nutrition during recovery phase, and then to talk about survivorship or long-term follow-up or aftercare. Has lots of different names for exactly the same thing. Some of the issues that happen during treatment will continue on through survivorship, so some of those things I'll touch on as well. So during the treatment phase, for those people who are done treatment, you'll remember this, and anybody who's at the beginning of treatment, that the focus is mainly on calories and fluid, to get in any food in any form, to drink anything and everything possible, pop and iced tea and lemonade and stuff you'd never think that you'd let your kids drink. Oral nutritional drinks if they're needed. Hard to say no to treats because you want your kids to eat anything. And fast foods are a reality because you want the kids to have absolutely anything. And of course, instead of having baked chicken, they're going to want chicken nuggets, so you're going to go for the fast food. The diet during the treatment phase is mostly comfort foods, carbohydrates, not a lot of proteins and fresh fruits and vegetables. So during the treatment phase, as many of you remember during that phase or going through it now, that it's unstructured days and nights, eating on the run, not a lot of time to do a big grocery shop, not a lot of time to make homemade meals, so lots of takeout foods, and then trying to eat and drink around hospital visits. There's a limited intake during this time of good quality proteins, fruits and vegetables, and whole grains. There's a decreased emphasis on balanced meals and structured meal times. There's not a typical breakfast, lunch, dinner, snack before bed. It's sort of eating as you can, getting everything in as you possibly can. So a little bit about overcoming the obstacles of treatment. So one of the big things is nausea and vomiting. And for lots of families that I talk to after treatment's done, this continues. Especially for patients with brain tumors, the vomiting can continue many, many years after treatment is finished. So these rules apply during active treatment and also during the survivorship stage. So to give small, frequent meals, because the stomach's like a balloon. There's only so much space, and if you fill it right to the top and you don't feel so great, it's going to spill over, you're going to throw up. So small, frequent meals, not to fill that balloon and keep it not full to the top. Avoid having liquid with meals because, again, the stomach's like a balloon. You fill it with solids, you fill it with liquids, and it's full to the top and it spills over. So to separate liquids, to not have them at mealtime. Also to try to serve the food cold. So if you can't smell the food, it's not quite as nauseating. Also throughout the day to have crackers, toast, cookies, different things that are dry. If you go long periods of time without eating, then you also get nauseous. And that's for anybody, but especially if you're going through treatment for a brain tumor, to go 8 or 9 hours, you're just going to feel nauseous from that alone. The other thing lots of families say that's very helpful is to keep the room well aired, to have the windows open so the smells don't stay in the room. So another common concern throughout treatment, lots of parents say, is my child doesn't say, this, I feel like this, or I feel like this, I just don't feel like eating. I can't tell you why, especially for the teenagers, just don't feel like it. Can't tell you why, just don't feel like eating. Can't really put my finger on it. So in that case, it's really super difficult because you're not the child or the teenager. You can't go into their system and figure out what it is or what to give them. You can be like a fast food place and make, like most parents do, make 6,000 different meals. Grilled cheese, peanut butter sandwich, how about this? And you make all kinds of different things. So that's not really possible over long term. So you can offer small, frequent meals. You can involve your child in the food preparation, to take them with you shopping, to help for Carol. Where'd you go, Carol? So Carol's, where are you? Carol's son actually went to culinary school, and that's such a good thing because that can help you in the preparation, that if you're involved in the food process, coming up with different things, watching the food channel, trying different things, and taking the child shopping or the teenager shopping can help spur on different things to eat. Serve favorite food more often. If they like mac and cheese, lots of mac and cheese. You just sort of stick with what works. And then because there's small amounts of food being eaten, make sure that the food that they're having has lots of calories and lots of protein because there's such a small amount going in. Constipation is something that you see in active treatment and also in survivorship. The biggest thing to help with constipation is to have lots of fluids. If you think of, I can't help getting the image of the physician that spoke earlier with the Stewart and the stool on the check. So it kind of has to do with Stewart. If you think of the stool, that there's not enough fluid in your body, there's not going to be enough fluid to pass the stool out. So you have to drink lots and lots of fluid. Doesn't matter what kind of fluid it is, water is the best, but any kind of fluid to help keep the bowels moving. High fiber foods, again, will keep the bowels soft. So high fiber, whole grain breads, muffins, cereals, any fruits and vegetables of any form is fine. Juice, fresh fruits are better because the skins are on the outside, but even juice or dried fruit, they all help. Prune juice is disgusting, absolutely, but some people can drink it and it works really well. Or even dried fruit, raisins, dried apricots, any of those things will help with the constipation. And also physical activity. Even if you're walking around, can help move the bowels. So any of those things, the more activity, the better. And then, of course, there's medicines to take, lactulose and peg flakes. I won't talk about today because they're quite awful. The other thing that we use a lot during treatment is nutritional supplements. So this is what you would use when your child's not eating enough to maintain his or her weight. There's all kinds of different types. There's a big market, so lots of different ones are coming out. The biggest one are the milkshake type beverages, which anybody who's gone through treatment knows these and particularly dislikes these because they're terrible. The Pediasure, the Ensure, the Resource, Nutrin Junior, they're all the typical same ones. But with this market being so big, there's lots of newer ones coming out. So these juice type drinks are really big now. They're like a Kool-Aid type drink in a Tetra Pak. Looks like a juice box, tastes like a juice box, but it has protein, vitamins, and minerals. So these are called fruit beverage. So those are quite acceptable. They come in peach, raspberry, orange. So those are pretty good. Bars, soups, and puddings. So there's a whole range of bars like power bars, vector bars. These are all super good sources of protein. And the other one that we have lots of success with are powders, like Carnation Instant Breakfast Powder, or I think it's called Breakfast Anytime. Nestle bought the company and changed the name. But it's just regular powder that you buy from the grocery store and you mix it with milk. It doesn't have to be quite as strong as the recipe says, but it just helps get that extra protein and extra calories in. So acceptance varies depending on where you are in treatment and survivorship. So try different times, try different flavors. So moving on to the recovery phase. So when treatment's finally done, the symptoms and side effects of the treatment slowly start to fade away. The taste changes that you get from the chemotherapy slowly start to fade away. The taste buds start to come back, and food starts to taste better. This isn't to say that some of the other side effects we talked about, the vomiting, the constipation, they're not going to go away immediately, but at least the food's going to taste a little bit better. There's less visits to the hospital and more time at home, which makes it a little bit easier for cooking and home preparation of food. So during the recovery phase, it's a time to start rebuilding muscle mass that's lost during treatment, to reconnect with your family and friends, and to initiate healthy eating habits that were lost during treatment. So for rebuilding the muscle mass, everybody's going to have a different phase of where they are in their physical activity abilities. Walking is very good, walking, swimming, anything that uses your muscles where you're carrying your body around is going to help rebuild that muscle mass. Reconnect and do things for fun. So do things with your friends, to do things with the family, to go for walks or hikes or anything that you do together makes it less of a chore and more of a fun activity. And then healthy eating, so no more of these, anybody who's come through Sick Kids knows about these blue calorie counts that we make all the families do, so no more calorie counting. You just eat for enjoyment, you eat what you want. Less snacking, more breakfast, lunch, dinner, and snack before bed. No eating in front of the TV, and then try to include food from the 4 food groups. So the dreaded Canada's Food Guide, which many people learn in their curriculum at school, but I really like Canada's Food Guide because it's real super simple and it works. So it's going to be hard to read, but I have a nice link where you can download and get copies of this, or they can mail copies to your house. So it goes through for each, I have a nifty thing here. Okay, here we go. So for each age, it tells you how much of each food group you need to consume. So the green is your fruits and vegetables, the grains are the yellow, the milk is and the dairy is the blue, and the protein is the red. So if you think of a plate when you're a child, or yourself if you're a patient in the audience, if you think of a plate and you put it into 4 quarters, there should be a color in each of the 4 quarters. So it should be 1 quarter green, 1 quarter yellow, 1 quarter blue, 1 quarter red. If your whole plate is grains, then you're missing a whole lot of nutrients because not everything is contained in this piece. So if you think of that circle plate, it should have 4 colors on it. So real difficult when for your whole treatment phase has all been carb to say, okay, now you need to have all these things. It has to be slow and to start to work slowly of having one of these and one of these and one of these, which will slowly decrease the carbohydrate section. And that's really, it's a nice family thing for everybody to do because that's really for everybody to have a combination of all these things. And then it says for each age how much you should have. So for a 14-year-old, should be 2 servings of meat, 2 servings of dairy, 6 to 7 grains, and 7 fruits and vegetables. So it'll give you an idea of what you should have for snacks and meal times. Yep. So that's what the other thing that's great about Canada's Food Guide is. It's hard to read here, but it tells you exactly how much 1 serving is, which is really helpful for the sort of 7 to 18-year-olds because they can look and see, no, I had protein, I had 1 peanut. I was like, that really doesn't equal a whole lot. So you have 2 eggs is 1 serving of protein. You have 2 tablespoons of peanut butter is 1 serving. So you have to sort of work yourself up from lots of times through treatment, the protein is very low, so to work up to maybe a teaspoon of peanut butter a day to try to get to 2 tablespoons for a whole serving of protein. But it gives you each of the specific amounts of everything.
But this is for everybody, not only for the cancer survivors.
This is for everybody, right. So it's a good family thing for all siblings, parents, grandparents, for everybody to have that plate with the 4 different colors and then that sort of portion size, for sure. So the other side of the coin is healthy eating. The other side is physical activity. So how much activity is a good amount of activity and what should you work towards? So Canada gives us guidelines for physical activity, and I've included this in the resource list at the end. It tells you how much per age you should be doing to sort of gauge where you're at and where you should get yourself to. So to continue with the eating for recovery, to increase the muscle mass, you need to increase your protein foods. That was the red portion of the Canada's Food Guide. So to have more eggs, lean meats, and chicken so you can build all that muscle mass back up. And then to make meals at home, to decrease your fast foods, decrease pre-packaged foods, decrease sugary foods like candy, pop, donuts, because they really have no nutritional value. They're super tasty, but there's no nutritional value for those. And then to increase the intake of your fruits and vegetables. So the big thing with recovery, go ahead, take a seat. So the big thing about recovery is to pace yourself, that the whole family, this is similar to what Stuart was saying earlier today, that the whole family's been affected by the diagnosis and treatment, and to take it slow, not to think that you're going to start everything all in the first week. Recovery slow, and goals should be small and achievable. Start with small things, with maybe having meal night one time per week where you all participate in meal preparation. Start with one activity, small achievable steps, and then to move on to the next step. So the next step in the course of treatment is survivorship or long-term follow-up or aftercare. At Sick Kids, we have an aftercare clinic, but lots of places call it survivorship clinics. So some of the nutrition discussion points that you can bring up with your team at these appointments are healthy eating, secondary cancer prevention, physical activity goals, bone health and osteoporosis prevention, overweight and obesity, and hyperlipidemia. Pardon me? A long-term follow-up clinic? I would think so, yep. At Sick Kids we have one, and I would think most of the adult places as well has long-term follow-up clinics. So healthy eating, the first point is to increase your intake of fruits and vegetables. So this is an issue because of the risk of secondary malignancy. There's lots of studies about preventing cancer through diet. So lots of them are well researched. Some of them are new. Lots of research being done at the University of Toronto. A friend of mine, Dr. Rao, is doing research in tomato products, lycopenes, which have been shown to decrease cancer risk. So the agents in fruits and vegetables are multifactorial. There's all kinds of different agents in fruits and vegetables. There's phytochemicals, flavonoids, sterols, lycopenes. So it's hard to choose these things in supplements and try to get everything you need, because I'm not sure everybody knows what it is in the nutrient or in the fruits and vegetables that's helping reduce the cancer risk. So having all these fruits and vegetables are good because it also helps with the bowel movement, so no more lactulose, which is super because that's awful stuff. So lots of research is on the brightly colored fruits and vegetables. So the brighter the color is, the more phytochemicals it has in it. So things like blueberries, pomegranates, blackberries, red peppers, broccoli, anything that's really brightly colored has those nutrients in it. So any of those, and it doesn't have to be, my kids always say, do I have to eat the vegetables that are raw? So it doesn't have to be raw, it can be cooked in a soup. Some families get a juicer and they juice it, it's completely fine as well. Cook it up, you can hide them. Lots of families put vegetables in like a spaghetti sauce that the kids don't even know about. That's also fine. You can have it in a juice. There's tons of juices now. Dried fruits also fine, doesn't matter. Any of the way you get it in is all great. And the advice is 5 or more servings per day. So if you think of what you're having now and you want to get to 5, small, easy steps, maybe start with 1 a day and then work up to try to get to 5 per day. So I don't know if the cartoon you can read out that it says, the mom says to the boy, see, this is called the outdoors. And the little boy says, oh, I've seen this level on my video games. So the hope with increasing your physical activity, if the studies have shown if you decrease or put a limit on screen time, which is TV, computer games, laptops, iPod touches, gaming systems, then automatically the children, without having any exercise guidelines, that the exercise or the physical activity will increase just by the fact that they're bored to tears because they have absolutely nothing else to do. They'll finally go outside or they'll finally find something to do because they're not preoccupied with this, some other thing that takes their time up. So just by that alone, studies have shown it increases physical activity. And of course, if you do things as a family or you're going out, there's going to be more physical activity because you're outside and you're doing stuff. To encourage activity with their peers, because as great as we are as parents, the kids are really quite sick of us at a certain point in the day, so they'd rather go out with their friends and go to the park and do different things without their without their parents, and then to have playtime. So even if it's not a structured activity, if they're just outside and they're running around and they're on the swing or doing whatever, it's still increasing your heart rate, and it's helping have an active lifestyle. So one of the things that's a big discussionary point in long-term follow-up or survivorship is bone health. So this is one of the references I put at the end is the About Kids Health that we have at Sick Kids. So this is a handout that we've been working on for a couple of years, the calcium bone building team for calcium, vitamin D, and physical activity. So the statement that came out from Sick Kids is that we want all patients, and this is like the one lady said here, this is for everybody. This isn't specific because you've had a brain tumor, but for everybody to have a lifestyle conducive to optimal bone health and to have regular activity, low impact weight bearing activity, so that you're carrying your skeleton around, you're carrying your bones around, and that's building the strength of your bones. So for bone health, we want to make sure that we have the building blocks for the bone, that they have enough calcium from low-fat dairy, other foods, calcium-fortified juices, or if necessary, calcium supplements. Again, nobody wants to take pills, especially when you're in survivorship and you're all done. You don't want to take pills anymore. The other one is to ensure adequate vitamin D intake from milk, other foods, or if needed, vitamin D supplements. And then to discourage the intake of tea, coffee, soda pop, Red Bull, because these negatively affect bone health. So all that nice bubbly stuff that makes your Coke and your ginger ale and your Sprite nice and bubbly is phosphoric acid, and that's really hard on your bones. So even if it's like Perrier water with the bubbles in it is really bad for your bones because that's the phosphoric acid. So that's sort of, if you're not taking in enough dairy and then you're having all that Perrier, then your bones are really going to be weak. So one of the reasons why we talk about the osteoporosis in survivorship clinic is because of the study that was done. So in pediatric cancer survivors, they looked at the intake of calcium and found that only 32% of the survivors met the requirements for calcium intake compared to 71% of the general population of the same age. So this is, you know, the exact population that's here today, that only 30% were meeting requirements. So you say, how much should you get? So these are the new guidelines which came out last year. These are the Canadian guidelines. So for 4 to 8-year-olds, you would need 1,000 milligrams of calcium. So 1 cup of milk as a general guide is 300 milligrams. So if you would have 3 cups of milk, you still would be short for your calcium. And then if you hit 9 years of age and you had 3 cups of milk, you're still really short. So you need to have lots of other dairy products to get in all your calcium requirements for the day. And then for vitamin D, that we say not to go in the sun, so you're not going to get it from the sun. And if you have sunscreen on, you're going to block the vitamin D from the sun. So you want to make sure that you're getting enough. 1 cup of milk is 100 units of vitamin D. So if you had 3 cups of milk per day and you were 9 years old, you would only be getting half the amount of vitamin D per day. And vitamin D as well, because it's a hormone, is also being studied as a decreasing the risk of secondary cancers. So these are some of the easy peasy things that you can do to make sure that your bones are nice and strong and that you have lots of vitamin D. So here's some of the foods that can kind of give you an idea, a sort of a self-check, and then also in the resources, I've included a big list of all kinds of different foods if the stuff you eat isn't captured on this list. But if you think of a day, if you have a couple of cups of milk, you have some Tropicana calcium-fortified orange juice, some yogurt, cheese the size of a thumb is 150 milligrams. So you think, oh, I have a cheese sandwich, a couple of these sizes. Maybe I have some salmon, 200, some waffles with some milk, and a little bit of KD. Oh, I might be 1,000 milligrams. But if you don't drink any milk and you don't cook with milk, then all of a sudden your intake starts to drop down if you're not a dairy drinker. So then you might need to have a supplement. But the list at the end can sort of help you go through and count up how much calcium you're getting. In Canada, the only food that's regulated to be supplemented with vitamin D is milk. Some newer yogurts are coming out with vitamin D, so when you do your shop, you can have a look, and some juices are coming out with vitamin D. So it's an easy way, without taking pills, to get the vitamin D up, is to look for either to have a good amount of milk or to look for these fortified juices. So one of the big things in survivorship clinic is overweight and obesity. So we have a dietitian who works at Toronto Sick Kids who deals with the obesity population. That's her only mandate, is to do counseling for this population. So some of these slides, her name is Erin Love, and some of the slides I took from her presentation that she does each year. So some of these are hers. So Erin's not here, but thank you, Erin. So obesity is a well-known, recognized late effect in survivors of childhood cancers. Overweight and obesity in survivors of childhood cancer has been linked to risks for cardiovascular disease, hyperlipidemia, diabetes, hypertension, which is high blood pressure, and then the social psychological consequences of being overweight. So some of these were alluded to this morning by the physician who spoke earlier. So some of these are chemotherapy related, the obesity, as well as from cranial radiation. And some of them are lifestyle related. So it's really hard to tease out what the cause is. So it can be decreased energy expenditure. They've done studies on survivors of all kinds of different cancers and put them in to measure the metabolic rate with an indirect calorimetry and a metabolic cart. So they collect all the CO2 that you blow off in a little, looks like a clear bread box, and showed that for age-matched siblings or controls, that metabolic rate is actually lower. So you sitting here and another child sitting there, the child who's survived cancer has a lower metabolic rate. So that's a little bit difficult when you eat a regular diet and your sib eats a regular diet, but you keep getting bigger. It doesn't seem quite fair. But they're not sure if it's a chemotherapy effect or a radiation effect, but the metabolic rate is lower. So this can also be due to reduced physical activity, the obesity, increased sedentary time with all the gaming systems, from having an increased calorie intake, or increased intake of fast foods and treats and that sort of thing. And also, for the flip side, there's some of the patients who come in during the survivorship clinics and long-term follow-up clinics, that not all patients are overweight and obese. There are some patients who still have difficulties keeping weight on, and it can be the flip side of these things, that there's some patients that have an increased energy expenditure. So when they do the metabolic cart and they look in the box, the metabolic rate is over 120% of what it should be. So when you need maybe 1,200 calories a day, you're actually burning 2,000 calories a day. So you're eating, it looks like you're eating tons and tons, but you just can't put any weight on. So the flip side can also occur. So there's been lots of studies of when's the best time to tackle the overweight and obesity issues. So the studies of these specific patient population has shown that patients are most motivated during or immediately following treatment. So the intervention should be initiated during childhood. Some studies showed where they let the patients get through all their treatment, grow to their growth potential, and then start intervention after 18 years of age. And they found that they weren't helpful, and there was poor adherence to the treatment protocols. So studies have shown that the best is to start right after treatment, before adulthood. So the general sort of tips for healthy eating would be to have not snacking and screen time together. So if there's Xbox going on or movie going on, not to have a big bowl of chips because you're just not paying attention to what you're doing and the chips are gone and the movie's over. To not use food as a reward. So when the children are doing well at different things, school or doing their chores, to not use food as a reward. To establish meal and snack times. The endocrinologist who works in the survivorship clinic said if there was anything that she would like to put across when we sat down to go through my slides, she said this would be the biggest thing, that there's no structured meal and snack times that she finds for a lot of patients. And this is a big thing, to have a proper breakfast, lunch, dinner, and snacks so that everything sort of falls into place once you have these established meal times. Lots of books have come out for patients who've gone through treatment, and one of the big things is to not take the control away from the child, is for the parents to determine what food is offered. So you serve the dinner and the child decides whether to eat the food or not. So the child regains control of their space, and they can say, I choose to eat this or I don't, and the parents serve what they serve. and then to remove junk food temptations in the home, so that if you had 20 different types of chips to choose from, the 20 different types of chips will be consumed at some point in time because they're there and it's a temptation. So a little bit about hyperlipidemia. They spoke about this at the session this morning. And hyperlipidemia is just a high amount of cholesterol level in the blood. So this is a nice discussion point as well. When you go for your follow-up clinic, your survivorship blood work, to make sure that you have your cholesterol and triglyceride levels checked, and to make sure that they're fasting, because that's the most accurate to have them done. And to have the high amount of cholesterol in your blood can lead to a buildup of plaque in the arteries, which is a risk factor for the development of heart disease. And the high amount of cholesterol, the hyperlipidemia, can be caused by many different things: chemotherapy, radiation, and also lifestyle, which is not a lot of activity and too much fatty foods and too much calories. So there was a large childhood cancer survivorship study, which they spoke about this morning, the Offinger study, and they found a greater number of cases of hypertension and hyperlipidemia in children who survived brain tumors compared to their siblings. And the treatment was three things: diet, exercise, and if needed, medication. So with regards to lifestyle, the diet should be low fat, low sugar, should be physically active on most days, no smoking, and then to limit alcohol because it increases your triglyceride levels, to maintain and achieve a healthy weight, to limit excessive calories, and to include omega-3 fatty acids in the diet. So I was happy this morning when the physician spoke and he talked about omega-3s, because I knew I had two really good slides on it, so I was going to stand up and give a big woo, yay! Anybody interested, come to my talk. So there's lots of discussion about omega-3s. In our lipid clinic at Sick Kids, we prescribe omega-3 fatty acids. And the role of omega-3s is because it's a natural agent, and it's been shown to decrease the bad cholesterol in the blood, and it helps decrease triglycerides. It can reduce blood pressure, regulate heartbeat, and prevent plaque buildup in the arteries, and it can protect against certain types of cancer. So it helps with hyperlipidemia, and it also decreases your secondary risk of cancer. So it seems, yes?
I'm sorry, any word on whether omega-3 or 369?
So that's, I was hoping that someone was going to ask that. So my next slide, I thought, how specific should I be on omega-3s? It's so in the literature, it's so on the TV and in all the magazines. I thought, I'll be very specific, and you can sort of take what you want from this. So it's really hard to distinguish between omega-3s and 6s and which one should I get and what sort of ratio. So there's three different types of omega-3s: alpha-linoleic acid, eicosapentaenoic acid, and docosahexaenoic acid. So those are the three at the top. And each of them are found in different types of food. So if you want to make sure you're getting everything that you need, you can't just be a flaxseed taker and say, I'm good for omega-3s. You have to conclude the linolenics and the docosahexaenoic to get both sides. And the one of them is more of the grains and oils, and the other ones are the fishes. And then as I was running through the slide for my kids, my 12-year-old is my worst critic, and she said, yeah, but you didn't tell people how to have them. You just said what foods. So then I added the tips in to say, you know, how you should get these things in. So one of the things that we have at our house when you open the door of the fridge is a big bag of Bob's Red Mill ground flaxseed. And whenever we make pancakes, we put the flaxseed in. Whenever the kids have cereal, we put the flaxseed in. If it's there at the door with a spoon in it, you're going to see it, and it's going to almost fall out. So it's a good thing to have. It should always be kept in the fridge because omega-3s can go rancid. So you always want to make sure you keep your supplements and any sort of flaxseed in the fridge. So it's an easy peasy thing just to have there. Whenever you make anything, you just throw it in. It doesn't have to be a huge amount, but you just put it in. The other thing that's easy is to have tuna or salmon, and you just put it in wraps or sandwiches. You see lots of nurses at the hospital have these little tins of salmon, and they just throw it in their salad. They just carry it around with them. They have tons of them in their bags, and they just dump it in whatever they're having. When you do your shop, to look for canola oil, so there's a very reasonably priced Baecel oil. It's in a yellow container with a yellow lid, and it says 100% canola oil. It's Baecel oil. It's lovely, and it's full of omega-3 fatty acids. And also, the soft margarines, base cell margarine, is going to have high omega-3s in it as well. You can use a canola oil to make your dressing. And then the good thing is to try to have fish at least once per week. So to have a fish night every Friday night or every Tuesday night, you have fish to make sure that you get in enough of the omega-3s. And then lots of patients ask this, and I think it's a good idea, even though you look at the amounts of omega-3s that's in eggs and yogurt, it's a little tiny bit that's in the food, but it's a heck of a lot more than if you chose the one that didn't, because it has none in regular eggs, but the omega-3 fortified eggs has more in it. So even though you look at it and it seems like very little, it's much more than the other ones, which are 0. So it's I always buy them, and I think it's a good thing to do. Absolutely. Yes. Right. So absolutely, tuna has lots of mercury in it. Salmon's a better choice, but in a cost comparison, salmon is much, much more expensive and is prohibitive for some people. So it's as long as you don't have too much tuna per week for your body size, as long as you're not pregnant or very small, it's a safe amount. The government says how much you can have ounces per kilo of your weight. If you were that specific, you wanted to look and see how much mercury you can have, it'll tell you how much you're allowed. If cost wasn't an issue and you had both available to you, I would choose salmon over tuna because of the mercury. Absolutely. But it's if you have a small amount once per week, it's not a lot of mercury. But it's a good question. Yes?
Where do milk products go? Is that ALA? Milk and cheeses?
So only if they're, if they're fortified. So they have some yogurts now which are fortified, but not inherent. None of them are, they add it to the, not inherently, no. And lots of baby formulas, right. So baby formulas are fortified with it now because it's not in the milk protein. And then some of the yogurts, you'll see, yeah. So you have to look for those ones. And then a focus on lifestyle behaviors in a general sort of summary sense. There's dietary, physical, and sedentary issues. So dietary changes is to just decrease the portion size, to decrease intake of fast food, pops, and treats, to increase the whole grains, fruits, vegetables, the low-fat dairies, and the lean proteins, to increase your physical activity, and to decrease the sedentary time or screen time, which is what it's called these days. So the survivorship goals would be, one, to maintain a healthy body weight. It's hard to have such a high intake of all the bad things if your weight is normal. So if you're eating a fairly balanced diet, your weight is going to be in check. The second goal is to be active every day. The third goal is to avoid extras and to decrease the intake of fast foods. So the goal of fast food places or establishments is to make money. They don't care about your health. They don't care about your sodium or your fat content. They don't give you omega-3s. They just want to make money. So the easiest way for them to make money is to serve very, very cheap, poor quality ingredients that are high in fat and high in salt, so that they sit around for a long time without going bad. So to keep that in mind, that when you go out, that it's to be considered a treat and it's really not of high nutritional value. The fourth goal would be to increase intake of fruits and vegetables. So whenever you can, to get in lots of fruits and vegetables in any way or form, dried, juiced, fresh of course would be best, frozen, any way. The fifth one is to eat your nutrients and not to rely on pills, because we're not sure with the studies that are being done what part of the fresh fruits and the fresh vegetables are the part that's helping us. So to choose different things is difficult to see if you're getting the right amount. So I included some of the places where I got the information from. So Canada's Food Guide, which you can download or they'll mail to you. The Physical Activity Guide, which will tell you per age how many minutes per day. This one is a Canadian Physical Activity and Sedentary Guidelines. So I find it how I use this for my own kids, because they say, you're making this up, that to have 1 hour of TV and video games per day, you've made up in your head. And so when I show them on a piece of paper from the government, it seems to hold more weight than what I say. So it tells you per age how much time they should spend watching TV and playing an iPod Touch. And then the About Kids Health through Sick Kids, that we have lots of guidelines that have been, or handouts, I guess, that have been written through the hospital and have been reviewed. So some of the things about bone health, about hyperlipidemia, some of the things about omega-3 fats, a lot more than what I spoke about. If you want more information about that, then you can go on About Kids Health and then type in the headline and it'll give you a 3-page handout on that specific topic. And then also, this one I like a lot, Eat Right, Be Active, from the Eat Right Ontario. Gives you very specific guidelines of different things, meal planning, snack planning, lunch ideas. It's a nice big booklet and they'll mail it to you, or it's online that gives you nice specific, real specific guidelines about recipes and that sort of thing. And then I think we're good. With 4 minutes to spare.
What is the difference between canola oil and olive oil? I mean, is olive oil just as good as canola?
So canola oil is going to have more omega-3s in it. Olive oil has lots of other great things in it, like monounsaturated fatty acids. It depends on what your goal is of when you're eating, that they're both good. If you want to increase your omega-3s to try to decrease the cholesterol, then I would go for the canola versus the olive oil for sure. Yeah. Yes?
Good nuts, bad nuts, as far as omega-3.
That would have been a good slide, actually.
Yeah.
Good nuts, good nuts, bad nuts.
That's the oils.
Right.
Coconut water is like touted as like
So
but coconut oil is
right. So you're absolutely right. So in the hierarchy of oils, walnut oil is one of the best oils, or the best if you're going to have nuts in your fridge, again, because they go rancid. Walnuts and almonds are good to have because they're full of omega-3s. So if you're going to, snack on something, those would be good to have fresh. You can go to the bulk barn, or you can go to Loblaws and get a big bag of walnuts or a big bag of just raw almonds. Those are good to have. Anything that's pressed into an oil, you have to be really careful of because it has lots of saturated fat. So if you're going to go to the effort, I would have the raw.
sesame seeds better than sesame oil.
Well, you could use, it depends on what your goal is, right? If you wanted to have more omega-3s, then I would go with the canola oils, and I would use the raw almonds and the raw walnuts for sure.
What kind of nuts to avoid?
Well,
Generally speaking.
yeah. Some of them are, all nuts are very good for you because they're a good protein source. So if you're not a meat eater, all nuts would be great. But some of them are higher in fat than other ones. So like cashews and peanuts would have higher fats in it. If you're going to go to the trouble, I would go walnuts and almonds because you're getting more bang for your buck, more good things. But if your child only likes peanuts or cashews, absolutely fine because it's a great protein source.
Is it better raw or roasted okay, or does it leave
Roasted, no, it's roasted is fine, yeah. Yeah. Raw is the best just because you're getting the whole outer fiber part, but either is fine, yeah.
even if they're whole but roasted?
Yeah, whole is roasted, yeah, it's fine too. Yeah, yeah.
The kids that were looked at in that study, looking at developing some of the secondary issues,
Yes.
how old were those children or those adults?
So it was more than 5 years after treatment ended, so it depended on what age they had their initial treatment. So some of them were still in childhood and some of them had gone on to adulthood. And it included 1,300, I think, brain tumors and then lots of other cancers as well as leukemia, lymphomas, non-Hodgkin's lymphomas, and some solid tumors. So it was a big study, and the brain tumors were small, maybe the second or third highest group of patients in the study. But some of them were still in their childhood.
So as little as 5 years after they started treatment, they were
Correct. Yeah, so if they were diagnosed at 5 years of age and they finished their treatment and they were 5 years outside of finishing treatment, they could still be within under 18 years of age. Yes. Mm-hmm.
What's your position on organic foods versus traditional foods?
So great question. Organic foods, don't have the pesticides. So again, some of them are very cost prohibitive because they're very, very expensive. Depending on which, some of them are better, some of them aren't. A lot of it's personal choice. Some things I buy personally that are organic because like things like apples and that sort of thing, because there's so much pesticides just to keep the crops going, whereas other things maybe aren't as necessary, like bananas, because really you're taking the entire skin off. But if you were to buy everything organic, it can get very expensive for lots of families. And then there's the risk of, if you're not using pesticides, is there other things that are growing in it, like bacteria and that sort of thing. So just to be careful of the small shelf life because it's organic. But it's mostly a personal choice, I think. There's not been any big studies to say one has more nutrients or one is safer or causes less cancers.
Taking omega-3s during cancer treatment, there's no contraindication for that?
So again, that's something to speak to your team about, that some high doses, if you're taking supplements, omega-3 supplements for smaller kids, can have some issues just with platelets and that sort of thing. There's just been some case studies. But as long as you discuss with your team and show them what you're taking, or say just to have flax seeds or to have that small amount that comes inherent in food is not usually a problem. It's when there's such a huge amount in a tiny little pill, which would be equivalent to so many pieces of fish and so much walnuts, you just would never be able to consume that amount. So usually the case studies that come out in the literature have been through pills, taking in very small children and small body size. Yes, go ahead. So lots of families do. They swear by it. Lots of patients through active treatment like to do juicing. I have lots of families who are tube fed, and they put juice through the tube, and we flush the tube quite a bit. So there's no studies that's going to say juicing helps and juicing doesn't help, but to get in all that nutrition of 5 or more servings of fruits and vegetables per day is sometimes a lot of food, right? If you were to pile it all up. If you juice a couple of carrots and apples and that sort of thing, it comes down to a pretty small volume. It's just sometimes it's not so palatable. So if you have a juicer and you can get all that food in a small volume and you can get it to taste good, it's just as good as having the fresh food, and it's just a lot of work, and sometimes it doesn't taste so good, is the only thing. But if you can find some families, some kids that are older, 14, 15-year-olds, say they have a nice mixture and it works for them and they like it, and they just juice it and then off they go to school. So if you find one that works for you, there's nothing wrong with it. It's super healthy and got tons and tons of omega-3s in it, lycopenes and all kinds of stuff, if you can add stuff to it. Oh, we're out of time.
And I just want to thank Miriam